Hamilton's shelters are struggling with a rise in COVID-19 cases, making the entire system vulnerable. Right now, many who rely on shelters and the staff who operate them are testing positive. And tonight, we're getting a look inside one of the overflow rooms where some are isolating. Sean Cowan joins us live with more tonight. Good evening, Sean.
Good evening, Nicole. Well, because of the chilly temperatures like tonight and the freezing months ahead, finding a shelter in the city of Hamilton is difficult before you even factor in COVID-19. But today I caught up with a couple of guys who managed to find a shelter, a bed. They are COVID-19 positive, and they actually have to share that room with 3 other guys.
We're told to isolate, and yet there's 5 people inside the room, and I wanted to find out what that means.
Show them how the rooms are. There's no doors on them. It's just like open.
Branston and Mark are currently on the 3rd floor of the Overflow Men's Shelter on Main Street. They've been there since Wednesday, and they say all 5 men sharing a room tested positive.
We have COVID, and we don't know why we're really going to be held, how long we're going to be held here for.
There's been a move to having people isolate in place. That probably works very nicely amongst a family of 8 that has their own home. In a shelter, there are some shelters who are doing it extremely well because they have the space to do it, they have the setup to do it, although the staff is a problem. There are other shelters that are just totally not equipped.
Unfortunately, Branston and Mark are not alone. Dr. Carrie Beal with the Shelter Health Network says the system has been hit hard with COVID, both clients and staff testing positive.
It would be easier to tell you the places that are not in outbreak.
And the Good Shepherd says that makes a bed even harder to come by.
In some cases, shelters have had to stop intake because of staffing levels and because of the risks of infection.
According to the Good Shepherd, lack of staffing combined with a high positivity rate is creating a tense situation.
I often ask people to think about their own anxieties or the anxieties that their own friends and family are experiencing with this pandemic, and then consider those anxieties overlaid without a place to spend the night, to a place to call home.
My humanity has been taken down. I'm no longer allowed to do the things that I usually do.
There are isolation spaces within the shelter system for those who are positive with COVID, but right now there are more people with the virus than the isolation spaces can handle.
Well, this guy is the most sickest, maybe. I don't know.
We've been asking for cleaning supplies.
There are 536 shelter beds in the city of Hamilton for men, women, children, and families. And even at the best of times, I'm told those beds were close to capacity. And all staff, as well as people using the shelter systems, are tested once a week for COVID-19. If there is an outbreak, they're tested 3 times a week.